During the COVID-19 outbreak, everyday life has changed and will continue to change for most people. Children may struggle with significant changes in their routines, which may interfere with their sense of security and emotional well-being. In addition to keeping children physically safe during the COVID-19 pandemic, it is also important to care for their emotional health. In an attempt to help provide support and services to the children and families in our community, some of our therapists at Youth Emergency Services and Shelter will be providing brief daily tips. These tips will focus on ways adults can help children feel safe, secure, and positive about their present and future.
Children's well-being often depends on the well-being of their parents and other caregivers. Children look to their adult caregivers to understand how they should react or feel about events or situations in their lives. It is important that these caregivers take care of themselves so they are able to care for others. Parents and caregivers can practice self-care in many ways, including staying connected to their social supports, getting enough rest and exercise, and taking time for enjoyable activities such as reading, art, meditation, or spending time outdoors. When parents and caregivers are struggling in their own lives to overcome everyday challenges or stressful situations, it may also be helpful to reach out to a mental health provider for additional support. If you need additional support, Youth Emergency Services and Shelter is here to help, and we have counselors that work with children, adults, and families.
Emotional and behavioral changes in children are to be expected during challenging times, especially now as our children are having to adjust to a new sense of normal. If children show an ongoing pattern of emotional or behavioral concerns that do not improve with supports, professional help may be needed. YES has multiple mental health providers, like the one you saw in this video. All of our providers have the capacity to offer telehealth counseling services through the telephone or online. If you have questions or concerns and want to talk further, you can reach us through the agency's website or by calling us. We can all make it through this situation if we support one another.